It's a couple weeks into calving season, and so far things have been going pretty well. The weather's been fine and the cows have been doing their jobs. Until one night, a big storm comes through, dumping a bunch of snow onto your farm. It's 11 o'clock at night, -20, the wind is blowing, and one of the heifers decides she can't quite figure out whether or not she wants to calve. Let's call her Heifer 101. The heifer's a bit nervous, so we give her a bit of time, but after about 90 minutes from when we first saw her calving, she still hasn't settled down to deliver her calf. So we decide to bring her into the barn, and once we get her into the calving chute, we check her out and realize that she's got a really large calf inside her. After a long, hard pull, we finally deliver a bull calf. He's alive and he's breathing, but he's not doing so well. So the question is, what should we do now? I'm Dr. Claire Wiindeyer, and in this video, I'm going to talk about colostrum management for beef calves. Newborn calves are vulnerable to disease when they're first born because their immune systems are naive. Unlike other species, like humans, they don't actually get any lasting protection from their mother while they are still in the womb. They depend on immunity that they get after they are born. So cows have evolved to make something called colostrum, which is the first milk that they make after they deliver a calf. And this colostrum contains important antibodies called immunoglobulin G, or IgG, that protects a calf until it can protect itself. In order to make sure that we're taking good care of our calves, we need to know the who, when, what, and how of colostrum management to ensure that each calf gets a good start to life so they can be healthy and productive. When it comes to beef calves, we don't want to help every single one get colostrum. The goal is that they drink the colostrum from their dam on their own. So we need to figure out who is going to need our help and who doesn't. We did a study to investigate this to figure out what we can look at in a newborn calf to predict if they're going to need help in consuming colostrum, or whether they're going to be able to do it on their own. We found two main factors in this study that were the most important predictors. Calving difficulty, where calves that were either an easy or a difficult pull were 4 to 11 times more likely to fail to consume colostrum on their own compared to calves that were unassisted. We also found that you could check suckle reflex. Calves that had a weak suckle reflex were 42 times more likely to fail to consume colostrum on their own compared to calves with a strong suckle reflex. For our calves that are a difficult assist or a hard pull, if they have a strong suckle reflex, we're about 50-50 in terms of whether or not they're going to need our help. But if they have a weak suckle reflex, we know that there's a really low chance that they're going to consume colostrum on their own, and that we're probably going to need to help those calves. So our calf number 101, who was born to heifer number 101, has a weak suckle reflex. We can put this together with the fact that we already know this was a hard pull. So we know that this calf has a really low chance of consuming colostrum on their own and will probably need our help. The timing of colostrum consumption is really important. Calves can absorb IgG for the first 24 hours after birth. However, we now know that the absorption of these antibodies is much better in the first 4 to 6 hours of life, and after that, it drops off drastically. So you can think about all these antibodies going into the intestines and needing to be absorbed. In that first 4 to 6 hours, most of the antibodies get absorbed, with only a few antibodies passing through the guts and not being absorbed. Later on, a lot more of those antibodies are going to fail to be absorbed. So timing is one of the most important factors for successful transfer of passive immunity. For our calf, we decide that because it's late and we're ready to go to bed, it's time that we give this calf colostrum. We don't want to wait until the morning. So the next question is, what should we feed this calf? Beef cow colostrum has an average of 150 grams of IgG per liter. If we compare this to dairy cows, the yield, or the volume that they make, is much higher, but the IgG concentration is much lower. Our beef cattle make smaller volumes, but the IgG concentrations are much higher. Furthermore, the colostrum coming from dairy cows can present a biosecurity risk for our herd. The big question that people always want to know is, how much colostrum should I feed a calf? In beef cattle, this is quite challenging because we want to balance getting enough antibodies into the calf without interfering with their drive to get up and nurse from their dam. Factors like the amount of antibodies, or IgG, in the colostrum, how long it's been since the calf was born, and how well a calf can absorb the antibodies are all going to affect the volume of colostrum that we should be feeding them. In a research study, we looked at different volumes and concentrations of colostrum and how they impact the time it took a calf to nurse for the first time. When we fed 1 liter of colostrum that contained 100 grams per liter of IgG, it took an average of 4.4 hours for those calves to get up and nurse from their dam for the first time. If we fed them 2 liters of colostrum with 100 grams per liter of IgG, the average was 3.6 hours. When we fed them 1.4 liters of colostrum that contained 70 grams per liter of IgG, the time it took them to nurse for the first time was significantly lower at 1.7 hours. We called this the Goldilocks effect because the calves that were fed a moderate volume of colostrum nursed from their dams the soonest. However, the amount of IgG that they absorbed into the blood was not impacted by the volume or concentration of colostrum fed in this study. Most of the calves absorbed adequate amounts of colostrum. The next question is, how should we feed colostrum to these calves? We did a study looking at different methods of feeding colostrum to calves. We found if they were bottle fed, on average it took them 2.3 hours to nurse from their dams for the first time. If they were tube fed, it took them on average 4 hours to nurse for the first time. And if we had to follow up bottle feeding with a tube because they didn't finish their bottle, these calves took an average of 9.2 hours to consume colostrum. When we bottle feed a calf, the antibodies go directly into their true stomach, or abomasum. So this is the most efficient and fastest way to get antibodies into the bloodstream of a calf. For our calf, we decide to bottle feed him, and thankfully, he drinks the whole thing. So in the end, what did we decide? We chose to feed our calf colostrum rather than wait because he was a hard pull and had a weak suckle reflex. We decided to go with a colostrum product, and we decided to bottle feed him 1.4 liters of colostrum because we wanted that calf to get up and nurse again as soon as possible. All of these decisions helped ensure that our calf got enough antibodies, and calf number 101 went on to be big, strong, and healthy.